Today's top stories. Laser therapy shows promise for brain tumors at home. Lecanemab. What does it mean for Alzheimer's care? Food allergy or intolerance? Key clues for clinicians. New breathalyzer detects when your body is burning fat. Heart failure drug may not improve exercise fitness in nHCM. Atopic dermatitis linked to lower height in children. Corrosion alert for Cobalt chrome hip replacements. For everyday shoulder pain, less treatment is often more. Giardia cases in England at highest level in almost a decade. And scientists tested 212 plant-based meat alternatives. Every one contained fungal toxins. We start with laser therapy shows promise for brain tumors. Laser therapy shows promise for brain tumors. TOPLINE laser interstitial thermal therapy, LITT, demonstrates low complication rates in a study of nearly 800 patients with brain tumors. Achieving a higher percentage of ablation in newly diagnosed glioblastoma was associated with better outcomes related to survival. Methodology: deep-seated lesions including basal ganglia, thalamus, insula, and corpus callosum, typically present with high surgical risk with open approaches. And survival outcomes are reduced when no cytoreduction is offered. Magnetic resonance imaging-guided LITT is a minimally invasive neurosurgical approach for ablating or cytoreducing intracranial tumors using hyperthermia. A total of 787 patients with primary, 445, or metastatic, 342, brain tumors treated with LITT using the Monteris Neuro-Blate system were enrolled from 25 U.S. centers between 2015 and 2023 in the LAANTERN Prospective Multi-Center Registry. Researchers prospectively collected demographics, intraprocedural data, adverse events, survival data, and functional status over time, with follow-up extending up to 5 years post-LITT. Extent of ablation, EOA, was determined by neurosurgeons based on post-procedural imaging and thermal dose threshold (CO). At-home Lecanemab. What does it mean for Alzheimer's care? With FDA approval of self-administered starting and maintenance doses of subcutaneous Lecanemab, Lecem in patients with mild cognitive impairment, MCI, or mild dementia due to Alzheimer's disease, AD. Anti-amyloid therapy has moved beyond the infusion chair and into the home. While the change could eliminate dozens of infusion center visits over the course of treatment, experts note that it does not turn Lecanemab into a simple take-at-home drug. MRI monitoring for amyloid-related imaging abnormalities, ARIA, patient and caregiver training, and clinician oversight remain central to treatment, regardless of route of administration. In the wake of the FDA approval, what should clinicians, patients, and caregivers know about at-home Lecanemab dosing? How did we get here? In the U.S., intravenous IV Lecanemab received accelerated approval in January 2023 and traditional approval that July for patients with MCI or mild AD-related dementia and confirmed amyloid pathology. The regimen is 10 mg/kg every 2 weeks, infused over about an hour. Then, in August 2025, the agency approved Lecanemab as a subcutaneous auto-injector for maintenance treatment after 18 months of initial IVT. Food allergy or intolerance. Key clues for clinicians. Adverse food reactions encompass a broad spectrum of clinical responses that occur after eating, ranging from toxic reactions linked to contaminated or spoiled foods to non-toxic reactions such as food intolerances and food allergies. At the 2026 Francophone Conference on Hepatogastroenterology and Digestive Oncology, held March 1922 in Paris, France, Gilles Maccani, MD, a gastroenterologist in Montfermeil, France, highlighted the need to clearly distinguish between food intolerances and food allergies to guide appropriate treatment. Food intolerances. Various mechanisms. Food intolerances are non-immune reactions that can stem from a variety of causes, including enzyme deficiencies, celiac disease, and lactase deficiency, which leads to lactose intolerance. Some are considered pharmacologic intolerances, most often related to biogenic amines, especially histamine, found in histamine-rich foods such as seafood and sauerkraut, or in foods that trigger histamine release, including chocolate and certain food additives. Among these, non-celiac wheat sensitivity remains a relatively new and still debated diagnosis. It is thought to involve not only gluten, but also other proteins in GRA. New Breathalyzer detects when your body is burning fat. Not many people are enthusiastic when asked to blow into a breathalyzer, but maybe doing so with no blue and red swirling lights and a law enforcement officer supervising and measuring something they might want to know will make a difference. Considering the current global epidemic of metabolic diseases, there are no simple and fast ways for patients to know whether lifestyle changes are affecting their metabolism. One way to do this is by measuring ketones or acetone, which determine whether the body is in ketosis, a metabolic state where the body breaks down fat to create energy. However, current methods for measuring ketosis either require patients to come in for testing or lack the sensitivity needed to detect smaller changes. It's crazy that metabolism is ultra-important for everyone's life, and there's not really a method to measure it, said Jan van den Broek, co-founder of Switzerland-based health tech company Allevian AG. Everyone has a smartwatch giving you your pulse 24/7. But if you ask, okay, and what is your metabolism doing, people usually don't know. Aiming to create a device patients could use routinely in their own homes, Van den Broek teamed up with research. Heart failure drug may not improve exercise fitness in nHCM. Topline treatment with sacubitril valsartan for 50 weeks in adults with non-obstructive hypertrophic cardiomyopathy, nHCM, and reduced exercise capacity did not improve peak oxygen uptake, PVO2, but was associated with reductions in interventricular septal thickness and the left ventricular mass index. Methodology: researchers conducted a double-blind randomized trial across 6 countries between January 2020 and May 2024 to assess the safety and tolerability of sacubitril valsartan and its effect on exercise capacity in adults with nHCM. They included adults with nHCM and reduced exercise capacity, PVO2 less or equal to 80% predicted. Patients had a mean age of 55.8 years, 77.5% were men, and 80% had New York Heart Association functional class II symptoms. After a 4-week single-blind run-in with placebo followed by sacubitril valsartan, 40 patients were randomly assigned to receive either sacubitril valsartan, up-titrated to 200 mg twice daily, or matching placebo in a double-blind manner. The primary endpoint was the change from baseline in PVO2, measured using cardiopulmonary exercise testing at week 50. Secondary endpoints included safety and tolerability. Exploratory endpoints include atopic dermatitis linked to lower height in children. Topline children aged 5-11 years with moderate to severe atopic dermatitis, AD, had lower heights but higher weights and BMIs than reference percentiles, with the largest height deficit observed in boys, according to a study. Methodology: researchers conducted a cross-sectional analysis of data from PEDISDAD, a global real-world observational registry of pediatric patients younger than 12 years with moderate to severe AD. A total of 1,329 children from 106 sites across North America, Latin America, Europe, the Middle East, and Africa were included. Participants were grouped by age, 5 years and 5 to 12 years. Gender and age-specific Z-scores and percentiles for height, weight, and BMI were calculated using CDC growth references. Mean eczema area and severity index, EASI, scores ranged from 13.4 to 14.9, with body surface area affected by AD ranging from 30.7% to 33.8%. Sleep disturbances were reported by 40.1% of children aged 0 to 5 years and 32.4% of those aged 5 to 12 years. Current treatments included topical corticosteroids in 75%, 78.7% of patients, systemic oral corticosteroids in 9.4%, 42%, and dupilumab in 16%. Takeaway in children aged 5 to 12 years. Corrosion alert for Cobalt chrome hip replacements. The Medicines and Healthcare Products Regulatory Agency, MHRA, has issued a safety alert for several makes of Cobalt chrome modular neck hip replacements. The agency said that, as a precautionary measure, patients with the affected devices should be identified and invited for clinical review. The warning stems from a review of all Cobalt chrome dual taper modular neck hip replacement systems available on the UK market. This was prompted by an alert in 2025 about one such device, Profmer Cobalt Chrome modular neck hip replacement implants, which had identified increased risks of wear, corrosion, and device fracture associated with those devices. The review identified potential increased risks of wear and corrosion associated with additional interfaces present in the design of some other implants. This related to two interfaces on the dual taper modular neck, one between the modular neck and the modular hip stem, and the other between the modular neck and the modular head. Peri-implant tissue reactions can lead to revision surgery in some cases. It found the added wear and tear may cause reactions in the peri-implant tissue, and this can lead to the need for revision surgery. How? For everyday shoulder pain, less treatment is often more. A patient arrives at the office of Lauren Simon, MD, MPH, expecting to receive MRI for their newly developed shoulder pain. Instead, Simon reaches for a pen and begins taking a history. There is no scan to order, procedure to schedule, or structural issue to fix. Evidence shows that new shoulder pain rarely requires imaging or aggressive intervention. In the absence of trauma or red flags, I explain to patients that imaging is not indicated at this time, said Simon, a professor of family medicine and director of primary care sports medicine at Loma Linda University in Loma Linda, California. Then we discuss conservative care such as analgesics and therapeutic exercises, and perhaps activity modification with a plan to reassess their pain. For most cases of shoulder pain not the result from a major injury, the better first step is to rule out serious conditions, offer reassurance, manage symptoms, and give the joint time to recover, according to a new clinical review published in JAMA Internal Medicine. Unwarranted imaging may lead to overdiagnosis, patient anxiety, and overtreatment, said Rachel Buchbender, MBBS, PhD, a rheumatologist and director of the Department of Clini. Giardia cases in England at highest level in almost a decade. Cases of giardiasis in England rose 11.4% last year, reaching the highest number of cases reported since 2016, according to new data from the UK Health Security Agency, UKHSA. There were 619 more cases in 2025, an increase from 5,450 in 2024 to 6,069 in 2025. London reported the highest number of cases, 1,568, followed by the Northwest, 1,029, and the Southeast, 977. Cases peaked in autumn with the highest number of reports in October, 599 cases, followed by September, 580 cases, and November, 574 cases. This was similar to the normal seasonality that had been observed in previous years, according to the UKHSA. The agency said that overall, almost two-thirds, 64.2% of Giardia laboratory reports in England involved males, with adults aged 30-39 years, 20% of cases, most affected. One outbreak of giardiasis was reported in 2025 in a nursery setting. In 2025, the rate of Giardia acquisition increased from 9.3 in 2024 to 10.4 per 100,000 population, with the highest rates reported in London, 17.3. However, the true burden is likely underestimated, the UKHSA said, with community studies suggesting substantially higher incidence than reported cases. Annual rise in cases the num. Scientists tested 212 plant-based meat alternatives. Every one contained fungal toxins. Scientists tested 212 plant-based meat alternatives. Every one contained fungal toxins. Hundreds of popular vegan and vegetarian foods may contain an unwanted extra ingredient, toxins naturally produced by fungi. Date, August 28, 2026. Source, Cranfield University Summary. Every one of 212 plant-based meat alternatives and drinks tested in the UK contained at least one naturally occurring fungal toxin, though concentrations remained below recommended EU guideline levels. Researchers say the bigger question is whether regularly eating large amounts of these foods could lead to potentially concerning cumulative exposure over time. Share, a large survey of plant-based foods and beverages sold in the UK, has found that mycotoxins, toxic compounds naturally produced by fungi, are widespread across vegetarian and vegan products. Researchers analyzed 212 plant-based meat alternatives, PMBAs, and plant-based beverages, PBBs, purchased from UK stores. Every product tested contained at least one of 19 mycotoxins, and some contained several. The study was led by the University of Parma in Italy and co-authored by Cranfield University. Researchers examined a wide range of products. That's all for this news briefing. Thanks for listening. Also, don't forget to hit the subscribe button.